بسم الله الرحمن الرحيم. هذه محاضرة حنشرح عن التينيا كرورس والتينيا فيدس. Tinea cruris, also known as joke itch and crouch itch. joke itch يعني joke يعني رياضيين فسمى joke itch. الأثليت يصير عادة عندهم infection. and crouch itch. crouch هي منطقة البرينيوم ومنطقة الانguinal region فيسموها crouch itch. occur more commonly in men on the upper and inner surfaces of the thigh, especially during the summer when the humidity is high. It began as small erythematous and scaling or vesicular and crusted patches that spread peripherally and partly clears in the center, so that the patches is characterized chiefly by its curved, well-defined border, particularly on its lower edge. The border may have vesicles, pustules, or papules. It may extend downward on the thigh and backward on the perineum or about the anus. The scrotum is rarely involved وهذه راح تساعدنا حتى نفرقها عن الكانديدا infection اللي السكروتم ممكن involved بالكانديدا infection. Etiology: dermatophyte infection of the groin is usually caused by Trichophyton rubrum, Trichophyton mentigraphids, or Epidermophyton flucosum. Differential diagnosis: infection with Candida albicans may closely mimic Tinea cruris, but is usually moister, more inflammatory, and associated with satellite macules and can involve the scrotum. Candida often produce colorate scales and satellite pustules. The crural region is also a common site for erythrasma, seborrheic dermatitis, pemphigus vegetans, and intertriginous psoriasis. Erythrasma often has a copper color and is diagnosed by wood light examination, which produce color red fluorescence, while seborrheic dermatitis generally involve the central chest and the axillae in addition to the groin. Pemphigus vegetans produce macerated and eroded lesions. Inverse psoriasis may be associated with colorite scales or with serpentinous array of pustules at the border of inflammatory lesions. When more typical lesions of psoriasis are lacking, a biopsy may be required to establish the diagnosis. Diagnosis of Tinea cruris is established by KOH examination, fungal culture, biopsy, or of course by fluorescent fungus. Immunofluorescence may be used. Treatment: the reduction of perspiration يعني التعلق and enhancement of evaporation from crural area are important prophylactic measures. The area should be kept as dry as possible by wearing of loose underclothing and trousers. Plain talcum powder or antifungal powder are helpful. Specific topical and oral treatment for Tinea cruris is the same as that described earlier for Tinea carboris. And the tinea of the hands and feet. Dermatophytes of the feet, athlete foot, is most common fungal disease. Trichophyton rubrum causes majority of the infection, although it can be caused by many other dermatophytes, including Trichophyton tonsurans. There may be an autosomal dominant predisposition to this form of infection, or it may be just being spread within families. Trichophyton rubrum typically produce relatively non-inflammatory type of dermatophytosis, characterized by dull erythema and pronounced salivary scaling that may involve the entire sole and side of the foot, giving a Mocasian or sandal appearance. The eruption may also limit it to a small patch adjacent to the fungus-infected toenails or to a patch between or under the toes. In some patients, extensive patchy scaly eruption cover most of the trunk, buttocks, and extremities. Rarely, there is patchy hyperkeratosis. Generally, the dermatophyte infection of the hand is a dry, scaly, and erythematous type, causative, usually suggestive of Trichophyton rubrum infection. Other areas are frequently affected at the same time, especially combination of both foods and one hand. both foot يعني أو عفوا both feet لأنه بسبب الشوز عادة. one hand عادة الدوميننت هاند لأنه patient حيستخدمها للسكراتشنج، يستخدمها مثلا applying treatment to the feet، فبالتالي تصير one hand. عادة النون دوميننت هاند ما راح يستخدمها. Tinea pedis caused by anthropophilic Trichophyton mentigraphids interdigital present with the three distinct appearances. ممكن تجي multilocular pulley involving the thin skin of the plantar arch and along the side of the feet and heel, and may present as erythema and desquamation between the toes and wide superficial onychomycosis. هاي أيضا بالMCQ most common cause of wide superficial onychomycosis هي Trichophyton mentigraphids. بس في حال إنه patient عنده HIV فالmost common cause هو Trichophyton rubrum. قلنا إنه هذه نفس الكلام in immune deficiency Trichophyton rubrum interdigital tinea must be distinguished from simple maceration caused by closed whip space which may not does not respond to antifungal therapy. أيضا tinea infection اللي interdigital type ممكن يصير يعني maceration بسبب ال wetness must be distinguished from tinea infection. Interdigital tinea must also be distinguished from gram-negative to web infection on and candidal infection. ممكن gram-negative ممكن candidal infection أو ممكن مجرد إنه maceration. Diabetic patient develop interdigital fungal infection at a younger age than patient without diabetes. Tinea Trichophyton mentigraphids often produce acutely inflammatory multilocular pulley. The burning and itching that accompany the formation of vesicles may cause a period discomfort, which is relieved by opening the tense vesicle. They contain tenacious, clear, straw-colored fluid. Extensive or acute eruption on the soles may be incapacitating, يعني غير محتمل. The fissures between the toes as well as the vesicles may become secondary infected with pyogenic cocci, which may lead to recurrent attack of lymphangitis and inguinal adenitis. Gram-negative to web infection may also supervene. يعني أيضا ممكن يصير إنه in addition to fungal infection يصير gram-negative infection. Hyperhidrosis is frequently present in this type of dermatophytosis. The sweat between the toes and the soles has a high pH, and damp keratin is a good culture media for the fungi. The high pH wet area أيضا تكون good يعني culture for fungi. Good culture media for fungi. Dermatophytes of the hand may also be associated with inflammatory tinea of the feet and began with the appearance of a group of minute, small, clear vesicles on the palm and fingers, and sometimes the side of and the top of the feet. The itching may be intense. Typically, both hands are involved, and the eruption tend to be symmetric. إحنا شرحنا بالمحاضرات السابقة عن dermatophytes reaction اللي قلنا ممكن يصير بالتينيا كابيتس، أيضا تينيا بيدس ممكن يصير يعني بالتينيا بيدس infection، بس الدرماتوفايت reaction يكون بالهاندز، يكون small vesicles يشبه البومفلاكس يشبه الإكزيما، بس هو dermatophytes reaction وعادة يكون bilateral و severe itching may be associated. Diagnosis demonstration of fungus by KOH microscopic examination as described for Tinea capitis and Cruris earlier will establish the diagnosis. For bullous tinea, bullae should be unroofed and either the entire roof is mounted intact on or scrubbing are made from the underside of the roof. هنا نقدر يعني البولي ناخذ الروف مالتها ونسوي له examination أو إنه الأندر سايد أوف ذا روف، بينما إحنا خدنا سابقا مثلا بالبيرن يصير أوبن بولا، بس بالإنفكشن فانجل إنفكشن ممكن إنه ناخذ الروف على مود إنه أو الأندر سايد أوف إتس، يعني نقدر نفتح البولي بالفانجل إنفكشن. Material may also be placed on saprode dextrose agar, saprode agar with chloramphenicol, mycosal agar, or DTM. The last three agar inhibit growth of bacteria or saprophytic contaminants. The last two may inhibit some of pathogenic non-dermatophytes. يعني الميكوزال and dermatophyte test media ممكن inhibit الباثوجينيك non-dermatophytes. وبالنسبة لأول ثلاثة اللي هن saprodes agar and mycosal agars ممكن إنه inhibit البكتيريا and saprophytics contaminants. The alkaline metabolites produced by the growth of dermatophyte change the color of the pH indicator in dermatophyte test medium from yellow to red. Prophylaxis. Hyperhidrosis is a predisposing factor for tinea infection. Because the disease often starts on the feet, the patient should be advised to dry the tooth thoroughly after bathing. Cold water laundering does not inactivate fungal element in the socks, which may serve as a source of recolonization. إذا هو مجرد يغسلها بمي بارد فممكن هذا يعني يصير عنده reinfection من خلال مادة السوكس. فالمفروض hot water. The dryness is essential to reduce the incidence of symptomatic reinfection. The use of an antiseptic powder on the feet after bathing, particularly between the toes, is strongly advised for susceptible persons. عندنا ممكن نستخدم powders. Is excellent dusting powder on the feet عندنا الزيزورب medicated powder or tinactin powder هذه ممكن نستخدمها. A plain tall cornstarch or rice powder may be dusted into socks and shoes to keep the feet dry. ممكن هذول نخليهم على الشوز أو على السوكس. Periodic use of topical antifungal agents may be required, especially when hot exclusive footwear is worn. التريتمنت هو topical ممكن هذول أنواع مختلفة من topical are effective but especially in tinea mano or البيشنت اللي هم يعني يحتاجون systemic therapy tinea manum or exuberant tinea pedis oral agents may be necessary. When there is significant maceration between toes, the toes may be separated by a foam or cotton insert in the evening. Aluminium chloride 10% solution or aluminium acetate 1 part نخففه ب 20 part of water can be beneficial. Interdigital tinea can be treated with antifungal impregnated soak. Topical antibiotics such as gentamicin or garamicin هو نفسه يعني that are effective against gram-negative organism ممكن في حال إنه helpful addition in some moist interdigital lesions إذا كان أكو super infection. An ulcerative type of tinea of gram-negative tube web infections systemic therapy may be necessary إذا ulcerative type bacterial infection. ممكن نستخدم systemic antibiotic or topical antibiotic. Keratolytic agent containing salicylic acid, resorcinol, lactic acid, and urea may be useful, although may lead to maceration if occluded. إذا under occlusion ممكن هي تسوي نفسها maceration. The treatment of fungal infection of the skin of feet and hand with griseofulvin 500 to 1000 mg per day can be effective. Dose by children 10 to 20 mg per kg per day. The period of therapy depends on the response of the lesions. Repeated KOH scrubbing and culture should be negative. Shorter courses are possible with other antifungal agents. Recommended dosing in adults terbinafine هي 250 تجي نستخدمها for 1 to 2 weeks. الاتراكينازول 200 ملغ twice daily for 1 week. Fluconazole 150 mg once weekly for 4 weeks. هاي هنا الصور عندنا interdigital tinea وهذه هنا tinea pedis وهذه أيضا example آخر على tinea pedis.